there are certain types of dementia that are very genetic and they are called familial. So something like frontotemporal but again, not all the FTD cases will be genetic. Some of them will.
The first question is by Jyoti Iyer. I request you to unmute yourself, and also if you can start the video. Hello, ma'am.
Hello. My father is a pediatrician. Age is 88. He's completely forgot his profession, everything, and not able to recognize. And we are facing it very difficult to meet with his needs. And every day he is not able to do. And now after Corona, my husband, who is 65, he is forgetting things slowly and becoming aggressive. So I don't want to see my husband as my father. So what are all the things I can help him to come out of this at least 65?
Hello, ma'am. Yeah.
Hello.
So, I get your point that there is like a memory loss and aggression in your spouse who is 65, I believe. Yeah. So, first thing I would suggest that you need to go to a doctor. You need to, speak either to a neurologist and get a checkup done. Now, the reason why we need the checkup is because there's a high possibility there could be some other factor that is causing it. There's definitely a factor that is causing memory loss or aggression. So we need to first identify rather than jumping the gun that, oh, it sounds like dementia. Please never do that unless and until you have got a proper diagnosis from the doctor, because there's a high possibility it could be due to maybe a vitamin deficiency or some other reason or some other medical condition. So
it's better that after Corona it increased.
Yeah. So it's better to go to a doctor and then, take it further. If you need help, I think they are happy to share our email address. You can reach out to us. But first, I would suggest that you see a doctor and then come to us. I hope that helps.
Moving on to the next question. I'd like to unmute Shmuel. Hello, Shmuel.
Yeah, you hear me?
Yes.
Yes, I
can hear you.
Okay. I want to ask you what, according to you, need to be a role of authorities in effective treatment in people with dementia from poor and low-income populations, low-income groups of population.
I'm sorry, I missed the question. Could you just repeat?
Can I kind of rephrase? He's asking what would be an effective treatment method for dementia for people from poorer families or socially backward masses.
That's a very...
Am I right, Shmuel?
Yeah. This is my question.
So this is a very tricky thing. And to be honest, we are talking about so much cost and everything involved. Yes, this is something that I face daily in my daily practice every day, that, we do suggest that, okay, get an attender, get an assisted living. It is very expensive. But then when we are talking also about the non-pharma interventions, okay, we talked about so much of therapies, cognitive stimulation, meaningful activities. So for the people who are, it's not to be differentiated. This treatment is for everyone. But someone who is not able to get additional financial aid or something, or a caregiver somewhere, they have a lot of things that can be done. First thing is to understand the symptoms and how to manage it. So, there is every symptom has a particular way to manage. Like, it could be sleep, it could be any neuropsychiatric issue or aggression, and the other therapies. So, the common therapies that I listed out, the cognitive stimulation, meaningful activities, this will help to slow down the progression and manage the challenging behavior. And I do know a lot of people who are not able to provide a lot of medical treatment and they have just followed this model. So there is a model of care that can definitely help for, say, poor people or even rural people. And there's a lot of social integration that is needed that helps to manage the symptoms. So yes, it is a very expensive disease, but there are people who are not able to afford. There are ways that without having further financial burden, there is a model that can be incorporated to care.
I hope that answers your question, Shmuel. Thank you so much for the interaction.
Yeah, of course. Thank you very much.
I'd like to ask a question before I move to the next one. Is dementia, can it be caused through genetics by any chance or through the genes we inherit?
Yes, certain types of dementia can be genetic and inherited. So nowadays there are a lot of these genetic tests available in a lot of hospitals. I think in our society it is generally a little expensive to get the genetic test, but then it is like a probability, and we don't. It's not that everybody will get it. There, because if you try to think about it, the causes of it or the risk factors, there's so many, like hypertension, diabetes, or head injuries, tumors. So not everything will get genetically, inherited. So, but yes.
Thank you so much. Next question is from Jai Bharati Basrur. How is amnesia different from dementia?
Okay, perfect. Yeah, I saw this question. Thanks for asking this question. So amnesia it could be a temporary memory loss, or it could be due to certain thing or something. I will put it into the reversible causes. If the cause is treated, it is a possibility that the symptom will go. Whereas dementia is irreversible. There is a pathology in the brain where the brain, there is a progression. So that is dementia and irreversible. That means it will keep on increasing. Whereas, so that's why it is best to go to a doctor to understand, is the person having just a temporary memory loss or a long-term memory loss? So long-term or basically a terminal illness. So this is where we really need to go to a doctor, and we can't just sit and say that, oh, it looks like this person has dementia. So amnesia can be something like a very short-term kind of a thing that can be treated, whereas dementia can't.
Thank you. I'd like to unmute Morgan. Hello, sir. Yes, sir. Am I audible? Can you? I can't hear you, sir. Can you please try speaking? Still can't hear you.
Sorry, sir, we can't hear you.
We can't hear you. Could you please write the question in the chat box and I'll bring it up soon?
That'll be great if you can write it in the chat box. Perfect. Meanwhile,
I'll move on to the next question. Meanwhile, the next question is from Swati. Is dementia associated with Parkinson's?
Yeah, so this is something, Parkinson, some cases of Parkinson can have dementia, but not necessarily all Parkinson will have dementia. These are two different things. Parkinson with dementia is slightly a different disorder. So it is like, dementia is basically that umbrella term, the cluster of cognitive impairment and memory loss. So not necessarily that Parkinson is dementia. Parkinson with dementia can be one. So it differentiates that. I think I'll just repeat it, that not every Parkinson case will have dementia. I
Thank you
hope
for
that
that.
helps. Yeah.
Next question is from Rakesh. Is there any survey finding correlating mind games like puzzles, chess to prevent the occurrence of dementia and Alzheimer's, etc.?
Yeah, it's very interesting. Like basically, all these activities that you're saying, these come under brain games or brain activity. So doing these brain stimulating activities can help to prevent dementia.
Prevent.
So in the prevention list, there was something, I think, learn new things, right? So you learn new language, you learn new activity. So your brain is getting stimulated where it was not being used. So activity suddenly is, say, very different language you picked up. So your brain till now was not using that region of it, and now it is getting stimulated. So likewise, when you do these brain games or brain activities, there's a lot of stimulation, and to some extent it will prevent. That doesn't mean that you just do brain activities and you don't look after your health. So it is all clubbed together. But yes, brain activities, there is a correlation that it will prevent dementia. But I can't quote an exact study right now, but I know it is there.
The next question is from Rohini. Is post-COVID, uh, is there an increase in the cases of dementia after COVID? And is there any connection between corona and dementia as such?
Uh, I think there is a lot of studies going on. I haven't come across which very significantly says it, but yes, there is some sort of a relation with COVID, because a lot of these virals will have some effect on brain, and a lot of neuro pathology did uh, took place while, that in COVID viral. So I'm just trying to recall. I think yes, there are studies published where there are certain studies which stated that post-COVID people may, not all, but some people may have a tendency towards neuro disorders. But I really need to look into to quote more here. Yes.
The next question is from Damodar P. Sharma. What are the tests to diagnose dementia? What are the test names?
Okay. So there are multiple diagnosis. There are multiple tests. Now these tests can be, as I mentioned, paper pen test. So there is something called HMSC, which is mini mental health, mini mental state examination, and then there is MOCA, Montreal examination. So like that, there are these tools. These are paper pen tests that are used. There's something called Edinburgh also, and so based on these neuropsychological assessment, a psychologist generally will make a report. So these are reports, these are paper pen tests, and these are the tools that are used. Based on this report, it goes back to the doctor, to the concerned doctor, and based on that report, they will then further, get MRI or a CT scan or some blood test done. So it is like it is multiple things that come together to get a diagnosis.
The next question is from Veeraja. Can a person diagnosed with an autoimmune disorder is more at a risk of suffering from dementia as the autoimmune disorder disease progresses?
I'm sorry, I didn't get it.
Uh, can a person diagnosed with an autoimmune disorder more susceptible to suffering from dementia as the disease progresses?
That's a tricky one. It is, I think it based on a very individual, that what is happening exactly as, for the brain pathology and how it's developing. Not necessary that everybody will have dementia, or not necessarily that all the autoimmune will convert into, they are progressive in themselves, but if somebody is developing some pathology in brain or some atrophy in brain, there's a possibility in this, but not necessarily all.
Ma'am, is there uh, any basic qualification required for nursing someone with dementia or taking care of someone with dementia? Is there a course or
Yes, that's a very
qualification?
interesting question. So, in our country, there is not like a very specific qualification required, to be honest, because there are very few professionals in this field, and there's a dearth for having more professionals. Not that there is a qualification required, but generally to work in this field, there has to be a good amount of experience working with elderly in elder care and say palliative care, especially talking with respect to nursing, right? So it's more like palliative care, elder care. Most of the time, people working in the field of dementia, they are highly trained in dementia care, because it's really very different from other disorders. So it is not probably, if probably in other countries, developed countries, they may need a proper qualification as a dementia certification or something. Whereas in India right now, we don't need any specific qualification. But once a person is absorbed in the field, yes, they are trained a lot by the respective organization.
Thank you for the reply. I'm going to unmute Mr. Damodar P. Sharma for the next question. Hello, sir. Just a second. Yeah.
Hello. Hello. Good afternoon to choosing this, topic. And, it is a fact that a very few people know about these things. And it is considered as a stigma to go to the psychiatrist, etc. It is a very interesting topic. I would like to know that in my own case, in 94, I met with a, road accident, collision of the two buses, head-on collision of the two buses in 94. And during those days, CT scan was not, very this well available. And at that time, I recall, after this, though so many people died, higher. So I recall I was lost my memory. Even I was not able to tell who was I. First I recall and told, that policeman collected us from the highway, etc. And that I recall those days, whenever I saw the buses, driving. I'm from Delhi. After that, that many things I lost, and many days when person used to, visit me, I would not able to call their name and tell my wife to note down, coming down, just like, waves.
Yeah. Yes.
After this, came back.
Yeah.
But still I recall the certain thing, I'm a postgrad from Delhi, retired officer. And I have gone that trauma and slowly came back. Then started driving. I used to go, then suddenly forget, see the person who is this. And sometime person used to tell, hey, what happened? This gentleman could not recognize these or something.
So, sir, how is your memory now, right?
Madam, I'm coming to topic that, memory portion. I'm a retired officer, came back. The memory loss done at that time was relating to this one, numerical figures.
Okay.
Suddenly you ask, and I am not, that I have gone through, I'm sharing my experiences. But as regarding that, suddenly people advise me that you take this, I took medicine, Mentate. It shows Himalaya good result. Now sometime, I'm coming to the topic, I'm facing this, forgetfulness. Then I recall,
yeah, you're facing memory loss now?
Sometimes I'm saying, that,
Yeah. So I would suggest, okay, I get your point. So see, probably after a accident, if there is a head injury, maybe that was like you developed amnesia and then you recovered it with your treatment and interventions. But now, after so many years, if you still have a doubt that there is a memory loss, I suggest highly that you go and see a neurologist, and you can just say that it looks like a memory loss, and probably then they will ask for these paper pen tests, and that will give a lot of idea that is it really the concerning memory loss, or is it like a very usual normal memory loss, right? So I would suggest that you see a neurologist first, and
Thanks, ma'am.
yeah, that will help. But do not delay in case if you think that you really need attention. But sometimes it is like we also think that am I forgetting, and of course because of age and all. So sometimes we also worry about it. So it's better to get a checkup done. See, every year, or I'm sure like every now and then you are doing a medical checkup, or sometimes people do annual checkup. So this should become a part of your annual checkup, especially after 65 and 60s, that you are going to a neurologist in case if you have a doubt that there is some sort of a memory impairment or memory issues, right? So,
Madam, one more thing.
yes.
Neurologist, okay, I get it. And as well as, CT scan or MRI can lead at this stage?
So it is the best will be the neurologist to suggest you. Do you really need it or not? But maybe they will suggest for paper pen test, and you should get that first done rather than just jumping for MRIs and CT scan. It will be the neurologist who will decide that what should be the evaluation for you.
Thanks, ma'am. Okay.
Most welcome, sir.
Thank you for interacting, sir.